Hi, my name is Frances Boyce. I'm the Chair of Be Safe Taranaki. Be Safe Taranaki are very proud to present this webinar with Dr. Tom Mulholland. I'd like to introduce Graham Wells to talk more about our speaker and what's on offer today. Thank you.
Okay, thanks Francis. My name is Graham Wells. I've been involved in Be Safe Taranaki since its inception about 10 or 12 years ago. Be Safe Taranaki was set up to promote the best health, safety and wellbeing outcomes for our members, for businesses in Taranaki and for the work that our members in Taranaki businesses are doing throughout the country. Be Safe Taranaki have joined with Dr. Tom Mulholland to have him talk about his views on COVID and COVID vaccinations. Tom has spent many years working in the area of preventative medicine, both from a mental and physical wellbeing perspective. Tom will talk to us now about COVID-19 and the COVID vaccination. Over to you, Tom.
Hey, g'day. Welcome to the Be Safe Taranaki crew. I'm Dr. Tom on a mission. Some of you might know me, having been a doctor in Taranaki for a number of years, lived there on and off for over 30 years. Probably was your parents' doctor or your grandparents' doctor. But hey, listen, it's great to have the opportunity to talk to you about something I'm really passionate about, and that's keeping people out of hospital where I work. And we're going to today talk about a very hot topic, which is vaccination, COVID-19, my experience and my perspective on it. So I've done a little bit of a PowerPoint, and so here we go. Hope you're well, hope you're relaxed when you're watching this. So look, my mantra is really health is safety, and that's not health and safety, and really looking at reducing your risk by improving your health and well-being. So I've called this webinar COVID-19 vaccination myths and facts, right? So we're going to explode some myths and talk about some of the facts as I see it. So one of the facts is that I've been asked to do this by the Be Safe Taranaki Trust, and I was in Taranaki last week and got to see some of the crew. And thanks, on behalf of everyone in Taranaki for the great work you've been doing over the years. So a little bit about me. I've got a first class honours degree in molecular genetics, ironically looking at mRNA in about 1984. And I did forestry when I left school, then went to university to do an honours degree before I went to medical school. As a first year doctor, I left Otago and came to Taranaki in 1989, and I worked at Base Hospital to about 2007. Also been a GP for 32 years. So I've got quite an unusual perspective as both an emergency department doctor and a general practitioner, still current in both fields. And I actually used to be the doctor at Fitzroy Engineering for a while, and Methanex did a locum for Tim Sprott a number of years ago when I was a partner of the Vivian Medical Centre. I was on the Taranaki District Health Board for about 6 years, 2000 to 2006. I founded White Cross, Medicross. That was just an empty building before I started that up. And started also Dr. Global Kind Wellness, which is going great guns. It measures your physical, mental and social health, and wrote a few books on healthy thinking. Been the doctor for Taranaki, Fiji and East Coast rugby teams, most notably when we won the Ranfurly Shield in 1996 with Andy Slater and Smiley Barrett and crew. I've had my own radio, TV and talk show host and written for Stuff for 3 years on wellbeing. And I've also written a few books which have ended up as international bestsellers in India, Brazil. I'm a keen surfer, snowboarder, diver, sailor, pilot, and a very proud dad. And, it was surfing that took me to Taranaki, and I was up there a couple of days ago picking up a couple of new surfboards. So still, like to call myself a Rocky Point local, although I don't get out as much as I used to. So I live on a boat in Auckland when I'm not around, and I just recently sold my house in Taranaki, but I look to get back, and it's a nice kingy up at the Three Kings, and that's my boat there. I was living on my boat, and someone says, do you get out on your boat much? And I'm like, nah, not as much as I like. So started the hop tour, the healthy oceans, people and ports, and circumnavigated New Zealand in my own boat. I also work as a hospital doctor. I've worked in a number of hospitals around New Zealand, Wairoa, Kaitaia for 6 months, lived at Ahipara, surfing shippies, and I've worked in Greymouth, Southland, Christchurch, to name a few, and the Chatham Islands. But that's a ship's doctor in the hospital there, and I work on a number of expedition boats, taking both my kids who were born in Taranaki and schooled in Taranaki to the Antarctic and also the Arctic, That's the Antarctic, and I've shown them polar bears and hundreds of thousands of penguins. So like to get out and about. So, you know, I left Taranaki about 2007 and moved to Waiheke Island, but still kept a house there for a while. And, you know, I worked at Auckland Hospital since 2007 and still work there, still on the roster, just casually these days. But, you know, I've seen a lot of death and disease in my 32 years. And a lot of self-harm, more increasingly self-harm, and most of it, if not all of it, is preventable. So, you know, about 7 years ago, I was on call and working in the hospital in the emergency department. And then, you know, apologies for this next slide, but this 50-year-old male came in with a, you know, splitting headache, became unconscious. I have to intubate him, ventilate him. And before I do that, I have to see if there's a bed in ICU. And I've been doing this in my 32 career. Like, there's not very many ICU beds in Taranaki Base Hospital. And even 30 years ago, most of them were full. So, you know, before COVID, and even now, I was in a provincial hospital just yesterday, and they're saying they're full and they don't have any COVID patients yet. So, you know, there is no capacity basically. But anyway, intubated and ventilated this patient, put him in a CT scanner. And what we noticed here, it's rather a bad slide, but there is a big brain bleed there, and that's non-survivable. And I have to talk to his family and say, listen, we've had this massive brain bleed. We'll take him to the intensive care, Department of Critical Care at Auckland, and then we'll see how he goes overnight. But that basically his brain dead. And I saw 3 of those in one night, and I thought, I've got to do something different. I've got to be the ambulance at the top of the cliff. You might have seen us on TV, documentaries on TV1 and 7 Sharp, doing prostate checks on Jeremy Wells in the back of the Ambo. So there's the Ambo there, and it's had multiple trips, and lived in Taranaki down the coast, and I have thrown the odd surfboard in there at Rocky Point and Stent. So I took off, say, a number of years ago, going around the country in this thing, and I've been right around the country 8 times, seen thousands of people, done lots of health checks, and this is an East Coast mission looking at farming, forestry, heavy machinery, workplaces, just doing physical testing, and develop this kind app, as they Know Your Numbers dashboard. And it's been an incredible journey, and a pleasure and a privilege to get around so much of New Zealand and talk to people about their health. And the whole mantra is trying to keep people out of hospital, doing workplace tests and picking up things early. So, you know, the mission's changed a little bit. You know, I've been working in the rescue helicopter in Fiordland and working in Te Anau, and done lots of work sites, visits, whether it's whether it's mills or work sites, and just trying to talk to people about their health, and really prevention is better than cure, which is my mantra. So this is just not, you know, something I've developed overnight with COVID. I'm passionate about it, and I still work in hospitals and GP clinics, but you know, things have changed remarkably for all of us, including me as a doctor, since this COVID came out of bats, and this virus first, you know, hit the world early last year and slowly made its way to New Zealand and into the wastewater of Stratford, I believe. So my life's changed. I still am able to travel some places, but this is in Whangamata just a couple of weeks ago. So on your left there, I believe it's your left, where I spend 2 hours on the phone just triaging patients. Have you been to a place of interest? Have you got any fevers, sweats, lost your sense of smell? And other places of interest, like a Brian Tamaki rally or something. But anyway, or a super spreader event. And if you have, then we triage you into the what's called the red zone. And in the afternoon, if you've had a fever, I have to put my PPE gear on, just like you wear PPE. Most of you got your high vis on, your steel caps. But this is my PPE, which is very awkward and uncomfortable. And the visor gets in the way when you're trying to look at little kids. But that's without COVID. I might have to wear this. And I was working in Whangamata, and there was no COVID in the community. So, you know, I actually dread when it does hit, and it is, you know, coming our way. So most of what I see and have seen for 32 years is in the winter, especially, is this RSV, respiratory syncytial virus, and see so many kids. And when I'm flying around in Te Anau, wherever, you know, like a lot of hospitals, Southland hospitals full, you can't visit them this winter because the beds are full, and, you know, and can you take them to Dunedin, or they're trying to shift patients out. And once again, I can't stress enough that this is all before COVID. So, you know, if you think that we're sitting there in hospital with all the spare capacity, we don't have it. And, you know, it's just, it is very frightening for us as doctors. So, you know, a fact from my point of view, COVID-19, it's a health and safety issue, 100%. It's all about your health and the safety that you have of your workmates and your family. In my view, it's not a political, a freedom or any other issue. It's just health and safety. It's like, you know, I remember when I first started my general practice in Taranaki in the early 90s and drug testing came in. And, you know, one of the biggest questions I get from people coming in is like working out on the rigs or whatever is like, how long does marijuana stay in your system? Because they were worried about you know, having drugs. Well, it's good sneezing on cue, isn't it? Yeah, I am doubly vaccinated. I think it's the cold air, and I am just self-isolating doing this webinar. But you know, and even forestry and certainly you know, professions or occupations, it was like we didn't want to drug test people because you know, we were worried that we wouldn't have a workforce because you know, it was quite prevalent in certain parts of New Zealand. I'm sure Taranaki is no different, but the point is that that became a health and safety issue, and you wouldn't even think about going to work for someone now who was, you know, drinking alcohol or smoking drugs. And, you know, to my view, you know, if you're going to work and you're not vaccinated, you do carry a much higher risk of carrying COVID and infecting your workmates and your colleagues. So it's really a health and safety issue, and the employer really has a duty of care to make sure that you are protected, like with PPE. So, you know, you wouldn't, to me, if I went to one of your engineering plants or something and I walked in my jandals and my shorts and, you know, my Taranaki hardcore t-shirt on and started to, you know, wind up a lathe or do something, you know, have a crack, you know, you'd look at me like I was completely bonkers because I wasn't wearing any PPE. So I guess medically, for, you know, 6,500 doctors that signed the petition, we think that if you're going to work without internal PPE with antibodies, it's a little bit reckless. So I've been on the front line. I've also been vaccinating people. This is in Wellington on Super Saturday, the first one, and volunteered my time. It was cold. I'm also a doctor for St John Ambulance, so freezing Wellington in a pop-up clinic, and had one elbow on there trying to stop it blowing away. A gust of southerlies come through. Even though it was sunny outside, it was still freezing inside. And that's what we were giving people. And I've done this in Whangamata, and you might have seen this on 7 Sharp. I was vaccinating Ben Hurley. But anyway, what I did was put about 0.3 of a mil into people's deltoid, and I got through about 150 patients in the day, and, you know, monitored them all. And, you know, there was one person that felt dizzy afterwards because they were hyperventilating and had anxiety. So I've certainly got experience both in the hospital and general practice land, and also vaccinating people up front. And, you know, I volunteered to do that on a Saturday. So look, these are my health views. You know, why? Well, our hospital system can't cope with widespread COVID. It barely does now. RSV virus, other deaths on waiting lists. And, you know, as I say, I was hospitalised at, they've closed their orthopaedic ward yesterday to make it into a negative pressure COVID ward, a provincial hospital. So elective surgery has been cut. And people will start to die of complications from not getting operations, whether it's a gallbladder operation or whatever. And certainly overseas experience, doctors that I work with and trust, just like if you work with people, whether it's at Fitzroy or Methanex or something, and they went and worked at a, you know, a methanol plant somewhere else overseas, you'd listen to their experience because, you know, you trust them and work with them. So one of my, you know, best mates is, you know, deputy director of the Scottish Ambulance Service and an emergency physician. He was head of Auckland Hospital. I worked there with him for, you know, a good 7 years, and visit him when I go to Scotland and stay with him. They were just saying they're just swamped with COVID, and a lot of, you know, people I know working in Sweden and London, and just absolutely that's all they see is COVID and COVID ICU admissions. And now people are vaccinated. Largely it's gone down to a trickle. That was the words they use in an Irish accent, trickle. Not enough of us are vaccinated to get this endemic phase. We're getting close, like Auckland's 90%, where we have to live and die with it. And, you know, people are dying, and they're starting to die at home. And I guess one of the most scary things I've seen is that we've been just given all these pulse oximeters to give to people at home, and we're going to be trying to manage people at home because, you know, MIQs fell, that's going to go west. We won't need one of those anymore. And then the hospitals are full, so you're going to have to manage your own COVID at home, put on your pulse oximeter when your O2 sats drop to whatever it is. where it is. You know, we're not going to come and see you. It's you need to get to hospital in an ambulance, and you know, like it's hard enough to get an ambulance as it is now. So imagine what it's going to be like once COVID gets out of Auckland and becomes widespread, which it will do. I mean, from day one when I heard about this thing, I said we're going to have to learn to live and die with it. So why do I get vaccinated? Well, I just hate getting sick. It's miserable. I also don't have time. I'm a contractor. I mean, I haven't been, you know, on wages for a number of years. So, you know, almost 30 years, I've always worked for myself. So I don't have time to get sick. In the 32 years of the front line, I see what happens to the unvaccinated, whether it's, you know, meningitis vaccine, whether it's diphtheria with kids, or, you know, measles, HPV, you name it, right? So I understand how it works in antibodies like bullets or nails. I want to run through a little bit of the science of vaccination, because there's a lot of myths around that. We need to wage war on this COVID virus. Going to work for me without being vaccinated is like going to a war with a gun and no bullets or nails. So my immune system, just like your immune system, is think of it as like a gun, but it needs to be primed and it needs to be, you know, told what bullets to make, right? And you can't develop bullets or nails or antibodies unless you've either been vaccinated or you catch the virus. Like you can't have this immunity to a virus that you've never seen before. I'll come to that. So here's a pretty picture, but it's not pretty if you catch it. That's not coronavirus. That's actually the measles virus. And this is coronavirus here with these, you know, crown of spike proteins. So this is what measles look like. And certainly, you know, early on in my career, I see quite a bit of measles, a lot of vaccination now, MMR. Overseas, you saw what happened in Samoa last year when the vaccination rate dropped. And measles is just a horrible disease. More people die of measles in refugee camps, you know, due to famine in Africa, of measles than of hunger, because they're unvaccinated, and it just rips through unvaccinated populations. And, you know, we've been vaccinated for years, and all those surfies that I've treated used to come and see me. I mean, you'll get vaccinated for your typhoid and your diphtheria, and, you know, you'd head off to, you know, Indo. I was a doctor at G-Land when the tsunami hit, and, you know, I'd be vaccinating everybody to go there, and you can't go to certain countries without a vaccination certificate, a yellow fever certificate. And, you know, you wouldn't take your kids to Africa or, you know, certain parts of Indo unless they're vaccinated. There's a vaccination now for malaria, which is great. But listen, when I was 1989, before I came to Taranaki, I worked in San Francisco General, and this is a COVID patient, right? But I just see so much, it was just wards and ICUs just filled with ventilated patients with HIV. And it reminds me, these chest x-rays of COVID, what it used to look like with fully blown AIDS, and with this called pneumocystis carinii, and it was PCP pneumonia, and so many people just have whiteouts in their lungs, and COVID lung looks very similar. So on the one on the left there, you can see the heart, and the black stuff's kind of supposed to be air, but when we put thermal imaging over it, we can see this double pneumonia there. And, you know, if you're a, you know, 25 or 30-year-old, you could probably saturate reasonably well on that and compensate, and you might survive that. You know, with one of those, you might, you know, not need to go to hospital. You know, you might get through it. But certainly if you've got other complications, like you're old, you're a bit overweight like me, and you're also, you might have asthma or diabetes. And, you know, I caught swine flu in 2009. I was working in Auckland ED, and went to see a patient, and that didn't have anything about being sick with the flu, and it was just low blood pressure, and they coughed on me, and then within an hour I had to intubate them and ventilate them because they got so sick with H1N1, you know, swine flu. And I got sick, and it really did give me asthma, and you know, I need inhalers sometimes when it's cold if I get a chest infection. So this long COVID is a real thing, and the damage to people's lungs. And I have seen some COVID patients, and I have seen the effect on their lungs and how much lung function they've lost from the damage of this COVID does to your lungs. So it's not just about dying, it's about getting really sick. And, you know, there was something on in the US about people getting compensation for long COVID now, and just the side effects they're having, and the long effects of the COVID infection are horrendous. So how a virus works, and, you know, this slide I love, and because of my genetics degree as well, but basically the virus uses a spike protein, whatever, to latch onto our cell. It injects its, you know, RNA and into our DNA, and then it uses our host to replicate it. So it's just like a competing engineering company from overseas coming in and using your plant and blowing it up at the end and making whatever you're making, whether it's metal or, whatever, if it's hospital beds at Howard Wright or whatever you're making, and then it blows up the factory at the end. So that's what viruses do. They take over your plant and they just make their own spike protein and make their own RNA, and then make all those little babies up the top to infect your friends, infect your workmates, infect your family, and infect vulnerable people. So, the virus doesn't really care what your political stance is. The virus doesn't really care who you voted for. The virus doesn't care about the traffic light system. All it wants to do is get inside, infect your cells, replicate, and mutate, and create more variation, such as the Delta variant and other variants we are seeing and will see. So that's basic life cycle of a virus. So how antibodies work is you might have seen measles, the flu, chickenpox, and we create these specific antibodies to neutralize these virus particles to stop them latching on to your cells and injecting their RNA. The problem is that in the green there, we've never seen this novel coronavirus before. So, we've got no immune system. We're naked, right? So antibodies are a bit like an umbrella. So if it's pouring with rain, what happens is you get wet because you can't defend yourself. But, antibodies are like an umbrella, and a few drops might get through. You might get a little bit sick. And I've got another slide coming up for that. So look, what's in the vaccine? That's a common question. Sugar, salt, and fat. It's relatively unstable, so it only lasts about 4 hours once it's out the fridge and in a chili bin. And that's just to coat this mRNA. Now, mRNA, I think, is fascinating, and I first started looking at it in 1984, which was a long time ago. It stands for messenger ribonucleic acid. And it's just a single strand of RNA that corresponds to the genetic sequence of a gene, and it's read by a ribosome, and they produce proteins. So just think of them as engineering factories. Your ribosome, they sit out in the cytoplasm away from the nucleus. So none of this genetic material goes near the nucleus of your cell. It goes straight to the factory, right? And then your factories make this spike protein. So how it works is, the mRNA sends the plans to the factory, the ribosomes, you make the spike protein. You're not making the virus, you're just making the spike protein. That gets into your blood. The B cells then make the nails or the antibodies to nail the virus spike protein so it can't attach to your cells and inject its genetic material and cause havoc. The other thing it does, it sends out signals to other cells like killer T cells and complement and this whole immune cascade system to try and get some help from their mates to come and kill the cells that are infected or kill the viral cells, the viral particles. So if you aren't vaccinated, as I said, you've got no nails or no bullets, and the only way to make nails is to catch the virus. So why would you take the risk of catching the virus without getting vaccinated, right? Without having your own, first line of defense. Now, studies have shown that, antibodies are high once you've caught it and survived it, but they're much better if you've been vaccinated, and then if you are unlucky enough to catch the virus, much lower incidence, or even people overseas who have caught the virus and then they get vaccinated, you still have to be double jabbed even if you've had it, because you're just, increasing the amount of antibodies you have. And we've all got different immune systems. Like every one of you watching this has got, by your age, young males will make massive amount of antibodies if you're healthy. Other people might not make as many antibodies, right? So everyone's got different antibody levels, and there's been some myth is that they've got equal amount of virus in your nose if you're vaccinated or non-vaccinated. That's not true. What they looked at was degraded mRNA, and so our bodies have killed this virus before it gets into us, right? It takes 2 weeks for your factory to the ribosomes to start making the spike protein, and then the B cells to make enough nails or enough antibodies to protect you. While the nails may last 8 months, or the antibodies, the factory has the plans to make more nails really quickly. So I got vaccinated in March and April. So my antibodies might be down 25, 50% now. So I'm hanging out for a booster, right? Because I don't want to go back and work in the hospital and get coughed on, sneezing on, and, exposed even with PPE. And, 115,000 doctors and nurses, which is more than the population of Taranaki, have been killed globally by this virus, because we're at the most risk, right? Because people that have got big viral loads and they're sick, they come and they cough and sneeze on us. And even though we've got PPE, we can still catch it. So the point is that even though still, while your antibodies might drop a bit, you've still got memory to start making new antibodies, or that's why we need boosters. And look, I've had the flu jab for 32 years. Every year I get it, and I just would not go to work without some protection, without my internal PPE. It would be negligent of me, and I'm not going to put myself at increased risk. The mRNA and vaccine are gone from your body in about 48 hours. It's eliminated, right? So when people say, oh, I've got these side effects or whatever, it's really hard to prove that stuff. And we've had 7 million doses of vaccine given, but the rate of all these things and rate of death and rate of complications of myocarditis, it hasn't increased, right? It's a rare event, myocarditis. I'm going to come to that. Like there's lots of, I really recommend this one if you want to get right down to the engineering, a lot of you in engineering. So, engineering, genetic engineering of this virus, it's fascinating how it's done, how Pfizer makes its COVID-19 vaccine. It's made in the States, E. coli, which is a bacteria found in our gut. They make the soup and it makes all this, DNA, and then it gets sent over to Germany and the RNA is extracted out of it. Then it comes back and it's wrapped up into like it's, fat, sugar and salt cell, and then it's shipped back to us. So, you can go to the New York Times if you want to have a look, and there's a very extensive article on how Pfizer makes this COVID-19 vaccine. So, it's not like they're hiding anything. And I think, from a molecular engineering point of view, it's fascinating, it's clean, and it's amazing technology. Just a little point through of a mill gets in, your body makes the spike protein, then your B cells make the antibodies. Instead of like people being scared of it, we should be just embracing it and going, this is fantastic technology, and it protects us. So here's a myth, the Pfizer vaccine has been rushed and it's new technology. I mean, that's just not true. It's a myth. The facts, the same process through MedSafe as any other, medicine that's been made. It's safer than paracetamol, and it's safer than the oral contraceptive pill, which, some of you might be on. But that certainly causes blood clots, and it's a recognised side effect of the oral contraceptive pill. And so, given we've had 7 million doses of this Pfizer vaccine in New Zealand, very little side effects, apart from the ones I'm going to run through, like fever and sweats and chills, which is actually your immune system kicking in. This mRNA technology has been around for 10 years. Rabies, HIV, and Ebola vaccines are all made with mRNA technology. As I say, it's fascinating. Once again, a picture of, a schematic picture of the virus and this, membrane that is on the outside, and then spike glycoprotein, and it's well studied, well documented. And just to show that I had to actually do a 3.5-hour e-learning program before I could inject someone with the vaccine. So I'm a licensed vaccinator, and it's ironic. I think when I was at Taranaki Base Hospital, someone showed me how to take out an appendix. This is a long time ago, and I learned how to do it and showed the next person. So certainly the amount of academic training you have to do to just put a little needle in someone's arms, a lot more than some of the other training I've had over the years. Fortunately, I think you've all survived. Antibodies are like nails, and I love this slide because it kind of shows you these antibodies coming out. And you can see the viral particles there on the right with the B cells, and you can see we might have a lot of antibodies. You might get a big viral load if someone coughs on you, especially if they're not vaccinated, because they got a 63 to 87% more chance of infecting you, right? So you get this big viral load, and it's just it's like having a home defense system or Star Wars, or you're just firing off all these bullets, but occasionally the odd one might get through and it might affect your cell. So that's why vaccinated people can still get sick. And we've got a 96% less chance of getting sick, but some people still do die if you're vaccinated for this exact reason, because some viral particles get through. So we never have, and we've never said that getting vaccinated is complete. It's not like smallpox or something. It's a different beast. So there's also these cytotoxic T cells that come through, and once your antibodies are locked on to the viral particle, they help kill the infected cell and swallow them up. So you're not exploding virus everywhere. So, you've really got to look after your immune system. And, there's obviously, eating good food and having all this kind of stuff is really important. But it's, it's important that we have internal PPE as well. keep coming back to these antibodies like nails or whatever you're doing in engineering, and you need it to or nuts and bolts to hold the thing together. Once again, this is what we need to nail. And there is new treatments coming out. There's pills that we can take, but it's still first line of defense is the most cost effective and still the best way. Prevention's better than cure. So you want to reduce your risk of actually catching it, reduce your risk of transmitting it. And if you are one of the unlucky ones who does get a little bit sick with it once you have been vaccinated, then there is medication out that hopefully, and I'm sure over time, it'll become like HIV, and in 5 years or the flu, we're going to have pretty good treatments, and it certainly won't be causing the problems it is today. But you just got to be alive to see that, right? Once again, keep coming back to antibodies are like nails, and just think of it as PPE. As I say, antibodies are little PPE, and I wear that on the outside, but even with that, I wouldn't go to work unless I had internal antibodies working as my PPE. So, some more facts. Over 7 million doses of the Pfizer vaccine have been given in New Zealand. That's a lot, right? So we've never had anything that's had this amount of study or research, and we're reporting things, and this has been analysed more than anything I know in my 32 years clinical career. I've personally given many vaccines. I've been on call for like weeks, 112 hours in 1 week, and the only side effects I saw were people with anxiety, and they were hyperventilating before they got vaccinated, and 3 patients that I saw all had anxiety after they were vaccinated, and in half an hour they came right. That perfectly normal oxygen saturations, and I haven't had to send anybody to hospital straight after they've been vaccinated. This was a week or so ago, but there were 2,005 cases in New Zealand then, and of those 1,914 were not vaccinated. So that's 95%. Of the 179 people who are in hospital, 176 of them, 98% of them were fully vaccinated. And driving home tonight, I heard something like there's about 90 people in hospital, about 9 are doubly vaccinated. Now, one of the interesting things is, people say, oh, but how come there's more and more people who are vaccinated ending up in hospital? And that's really simple maths, right? Because before there was any vaccine, 100% of people, makes sense, right, in hospital were non-vaccinated because we had no vaccine. Now the scales have tipped. There's 90% of us, say almost in Taranaki, almost there, we're almost there, is that, only 10% of people are not vaccinated. So it becomes a less and less pool of people that are not vaccinated. But what's really important is, say that if based on the numbers, if all of New Zealand wasn't vaccinated and, we hadn't had the lockdowns and the borders were open, you might accept, whether it's 10,000 people in hospital, right? But the fact is, and I'm just picking numbers, but, you get, as more and more of us get vaccinated, instead of 10,000 people being in hospital, maybe 1,000 people will be in hospital. And of them, you might say in time, 30% of them might be vaccinated. That's because there's just less and less vaccinated. So if everybody in New Zealand was vaccinated, you're still going to have 2% of people who are going to get sick. So with COVID, so everybody in hospital would be vaccinated because everybody's been vaccinated. I hope that makes sense and I'm not confusing you. So over time, I'd expect the number of people in hospital, or the percentage of people in hospital who are vaccinated to climb, but the absolute number that you'd expect are going to be a lot less. That's the whole point, right? Instead of 10,000 people in hospital, you might only have 1,000 people around the country in hospital. Hopefully we don't get to that. So who shouldn't get vaccinated? It's actually very small. And people go, oh, my doctor's told me not to get vaccinated. I don't believe that. It's only if you're really allergic to this PEG or polyethylene glycol. There's about 100 people in New Zealand, or you've had a very serious reaction to a previous vaccine. And by that, I mean a documented, like anaphylaxis or a documented problem with the vaccine. Not I felt dizzy or I felt unwell or I was short of breath. And, I have seen stuff there. I've tried really hard to be objective, but, I saw someone posting in a hospital bed the other day, and they look perfectly fine. They're pink, they got makeup, and they're going, I'm really sick, and the doctor sent me home with a clot that that, you know, and said I just had to rough it out. And like, that's just absolute rubbish. There's no way we'd send anyone home with a lung clot or a blood clot to the lung, because it can be fatal, whether it's the oral contraceptive or whether you're the 7% of people that gets lung clots or PEs, they're called pulmonary embolus, from traveling on planes. So, you know, when you could. So, you know, if you've got a documented pulmonary embolus by having what's called a VQ scan of your lung, you know, you get anticoagulated, you get, you know, you get blood thinners, right? Because it's negligent to send you home without blood thinners. So when people go, I went to the hospital and they never did anything, that's because we couldn't find anything wrong with you, right? Anyway, and certainly having worked in hospitals for 32 years, we're pretty sensitive about investigating things, and certainly so many people are being admitted with chest pain that you'd normally get admitted with a chest pain, because that's what I see. And you know, when I set up White Cross, you know, I was on call and go to Waitara, and you see people with chest pain back in the 90s and 2000s, and you go, well, you need to go to hospital now. Because 90% of people have had a vaccine shot, you go, well, could this be myocarditis, or could this? And we're certainly sending way more people to hospital, in my experience, than we used to, because we're saying, well, is there a link between the vaccine? We're looking at it, you know. I'll come to that in a minute. The other people that shouldn't get vaccinated, if you're unwell with a fever, give your immune system a chance to make antibodies. And once you've been vaccinated, rest and don't go hard out. Don't go and, you know, go for a big surf or a run or a bike ride or go to the gym. And the very few cases, like 1 in a million of myocarditis, has been in the second dose in young fit men, and often it's related to exercise. So I've always said in my whole clinical career, don't exercise if you've got the flu. Don't exercise, you know, if you're unwell or got a fever, because you are going to increase the risk of myocarditis in the heart. And I've seen a few people that have had heart transplants, needed to because they got heart failure, because they've exercised when they've had a viral or a febrile infection. And when I had my radio show on Radio Live, you know, I had a heart surgeon on, and you know, he just really described what people say. When you get myocarditis, it feels like you've been hit by a bus. And this is way before we started vaccinating with COVID. It's been endemic and out for a long time, and often it's the virus causes myocarditis. So look, you can report an adverse reaction. You go to this website, report.vaccine.covid. It's up there, and you can choose to be a member of the public. I choose here to be a health professional or a general practitioner or a hospital medicine doctor, and we report this stuff, and we report our adverse reactions. Now, there is well documented adverse reactions, and one of the myths that, you know, does put my blood pressure up a little bit: doctors are sweeping side effects under the carpet and not reporting them. That's, sorry, quite frankly, bullshit. You know, excuse there's a good Taranaki pun, Ferdy, the bull. But you know, like, I mean, we're more hypervigilant than anything. In my whole career, like, if you come to White Cross or the hospital or whatever, and, you know, do I send you home if your kid's got a fever? Am I missing a meningitis? Am I missing a heart attack? You know, am I missing a pulmonary embolus? This is before vaccination. So now we're hyper vigilant, and we're looking at things and going, could this be due to the vaccine? Like, if we don't report things, you know, there's this myth out there that if we report things, we get in trouble. That's bullshit. You know, like, you're judged by your peers. So if we ever sent anyone home, or we didn't admit them or didn't take them stuff seriously, and they had something seriously wrong, we get in serious trouble. So we don't get in trouble for not saying things. We get in trouble by not doing things that we're supposed to. And one of the reasons I stopped doing forestry and went to medical school and became a doctor, because I don't like being told what to do. And I know a lot of you don't like being told what to do, or you have to get vaccinated. So, I mean, I chose to get vaccinated because, you know, I can't wait for my 3rd dose. But in medicine, like, you know, no one can tell me what to do. And even working in Taranaki-based hospital, you know, even just as a junior doctor, a couple of times people told me to do something. I'm not doing that. I don't think it's safe. So we don't do things if we don't think they're safe. Well, inherently I don't. And there's no way I'd be vaccinating people, including my own children, if I didn't do that personally, but they got vaccinated, or recommending it, unless I thought it was safe. So there's no way we're sweeping stuff under the, like, who would do that? And it just doesn't make sense. We're just, you know, creating an issue and exposing ourselves to litigation. And, you know, touch wood, I've had 32 years without a complaint. I don't want to do anything wrong. Anyway, so look, these are the complications of the disease. This is on the immunity. I really recommend, if you want good, solid advice, go to IMAC. The website's at the end, but well documented problems with COVID-19, pneumonia. I've showed you some acute kidney and liver injury. You get brain inflammation, hemorrhages, seizures, inflammation of the heart, myocarditis. You get this with the virus, stroke, heart failure, blood clots, and certainly this long COVID. A lot of my friends over the UK are seeing a lot of blood clots and PEs with long COVID. Acute respiratory failure, well, that's what kills you, or that's why you need to get ventilated. And that's one of the most scariest things I do in my clinical career, is paralyzing someone, or putting them to sleep and then paralyzing them and putting a tube down their throat. You've only got a couple of minutes before they run out of oxygen. So you've got to get the tube in, and, looking into people's eyes, and saying, and, they're gasping for air. If got respiratory arrest, and they go, how long, or someone the relatives, how long are they going to be ventilated for? And it's like, well, until you either get better or you pass away. And it's, putting people to sleep and then paralyzing them is not something we do lightly or want to do. And but it's something that I'd just prefer not to do. So I'd much rather that you were surfing down the coast, hopefully not dropping in on me, or I'm dropping in on you, and or biking, on the walkway, or doing whatever you want with your kids, rather than being up at Taranaki base about to be intubated. It causes multi-system inflammation. You get this muscle and brain function. Like when you're on a ventilator, there's all sorts of complications for that. You get this long COVID syndrome, fatigue, depression, memory loss, cough, and death is a pretty serious side effect. Common responses, which are well documented, and if you care to look at my Dr. Tom on a Mission Facebook page back in March and April, I documented on the second dose, I felt flu-like, I had fevers, I had chills, but I took paracetamol and some Brufen, and I was better the next morning, right? Muscle aches, fatigue, chills, fever, joint aches, but most of these pass in about 48 hours because the vaccine's gone within 48 hours. Very rarely you get lymphadenopathy, which is swollen lymph glands, and myocarditis, very rare in young males after the second dose. It's still like 1 in a million. Occasionally severe allergies can occur, but that's why you have to wait 15 to 20 minutes after you've been vaccinated. But certainly personally, I haven't seen any severe anaphylaxis. It can happen, but normally you've got an allergy to something like polyethylene glycol, which is in toothpaste as well, I believe. Myth: leading doctors are not getting vaccinated and refusing to work. Like, sorry, but that's just another bullshit, it just doesn't make sense, and when I hear this leading doctors, bullshit, if you look and investigate them, and they're on YouTube, they're often sitting in a room, they've never worked in an emergency department or ICU, they say they've invented this, it's crap. And when you actually, I've been so many links from people to see, and have a look at this or this expert and that, but these experts are not on the front line, and they're not, like, I don't know one doctor or nurse who's working in an ICU or intensive care, especially those that have worked in COVID, who aren't vaccinated and who aren't pleading with people to get vaccinated, right? So facts: 6,500 New Zealand doctors have signed a petition supporting vaccination. Only a handful of them are not getting vaccinated. And it just doesn't make sense to me. People go, but doctors are against vaccination. And I'm like, a handful of them, right? But then if you're using that argument that you're a doctor, and what are you a doctor of, right? It's like, but 6,500 of us are vaccinated and recommending to people. So to me, that saying that is like saying, these people are a minority, and they're not ED, they're not ICU doctors that I know of, and they're either retired, or there's a few. I know there's a GP in Methven that doesn't want to get vaccinated. That's her choice, right? But there's also a minority of doctors who have serious alcohol problems. I'm not saying these doctors do. I'm not making that correlation, but a minority of doctors have serious alcohol problems. But that doesn't mean you want to be an alcoholic, right? So, just because a handful compared to 6,500 are not doing it is not a case or an argument for you not to do it, right? Because they're swimming against the tide, and they don't know. It's not like they've discovered something, or that's the other thing. People that have done their research on social media have found things that all of us working at the coalface, and often because we don't have time to post these videos, we're too busy bloody working. Speaking of which, it looks like Jonesy might have had a few too many drinks, but he's just been working. He's not by the way. He's one of the most respected doctors I know. It's a little bit maybe unfair, but he did say I could share it, and he has shared it on his Facebook. But a moment of reflection after taking off his PPE just out of recess, where a patient told me they didn't need the COVID vaccine because they didn't think they'd get COVID, that we'd look after them if they got sick anyway. Also didn't believe the hospital was near capacity already, so we won't be able to look after everyone else if we're full up. With COVID patients, no words. And this is recently, in Auckland City Hospital where I work. And, Jonesy's been there for years, and he's a researcher as well. He's a scientist as well as a doctor, double doctor. And, he researches so much, and, so much respect for him. And, him saying no words, but that's just like if I walked in, as I say, to an engineering shop and bare feet or jandals and wanted to use some heavy equipment, or no earmuffs or something, you'd look at me and go, no words, look at this guy coming in. And, that's what we see every day when we go to work. And that's why I'm doing this webinar, is trying to share my experience and that of my colleagues who are, a lot of them a lot more experienced than me. Jonesy just works in ED full time. He's not cruising around in an ambulance. Sometimes it's cruising, sometimes it's fixing it in exotic locations. So another question, why are vaccinated people afraid of non-vaccinated people? Well, you're more likely to have COVID in the first place if you're not vaccinated. And then you're 63 to 87% more likely to pass the virus on to your friends, family, and workmates if you are not vaccinated. So, like I was supposed to be getting married in a couple of weeks. We postponed it because of lockdown was a major reason, but also certain people weren't vaccinated, and you've got the non-vaccinated saying, well, you can't not invite us. And then you've got the non-vaccinated saying, we don't want to go with these non-vaccinated people. And that's common in workplaces. And some of the sites that I've been going around and visiting around New Zealand, they have, if you're not vaccinated, you can't come to the sites. They're trying to protect their workers. And so they should, right? So if you're a contractor, you cannot go to these sites. And I don't know whether Methanex or those sites have got it, but because the cost of shutting down, like look at the cost of shutting down Auckland and look at the cost of shutting down the Waikato or anything, or a hospital, the cost of when it hit North Shore, like transferring patients out. So if your worksite has someone who's non-vaccinated and they're maybe just a bit of a sniffle or not many symptoms, and they pass it on, and you start getting really sick, you imagine your workplace is going to keep cut down production. And a lot of you are in essential services, manufacturing and making things. So you really do need to protect yourselves and your work place. And so I think it's responsible that people should be vaccinated at work and protect your customers and your clients. And certainly, living on a boat, there's so many tradies now, or people that are the market's determining it. So we don't want non-vaccinated people in our houses, on our boats, and our work sites. And that's because vaccinated people, they're scared enough to get vaccinated in the first place. They don't want the virus, so they're scared of catching it, and they're much more likely to catch it from non-vaccinated people. So that's why they're scared. And it's one of the things like, why are they wearing a mask, and why are they bothering if they're vaccinated? They've still got a small chance of catching it, but much higher chance if you are not vaccinated. So look, just summing up, here's some facts. And this is from the Royal New Zealand College of General Practitioners. This came out about a week ago. So far, over 10 million people around the world have died from COVID-19. Now that's, twice the population of New Zealand. As well as being deadly and highly contagious, the virus can have serious long-term side effects called long COVID. I've touched on a bit of that. Without the vaccine, almost everyone will get the virus. So your best chance of not getting it and not getting long COVID or getting minimal symptoms or just a sniffle is to get vaccinated. Those infected without being vaccinated are at least 20 times more likely to get dangerously ill. This is even higher for Māori and Pacific. The vaccine is cleared from the body, which I've already said, within a few days, leaving the body's defences strengthened to fight the COVID. If vaccinated, you are less likely to spread the virus to your family, friends, or whānau, friends and workmates. And as I said, the vaccine is MedSafe approved and safer than either the oral contraceptive pill or common pain relief, such as paracetamol, So, I think it's really important, these facts. Once again, you're far more likely to catch it and pass it on if you're non-vaccinated. My advice is if you've got any concerns, talk to your own doctor if you can get in to see them. Increasingly, it will get harder to get in to see your doctor. And certainly areas and parts, I travel around the country, GP practices have closed. They're not taking new patients. And as we get more and more, like we'll be streaming non-vaccinated people into, the days of everyone sitting in the waiting room and coughing at each other are gone. So we have different areas where I work in Te Anau, where I call it welcome to McDonald's or whatever drive-through, where they come through the ambulance bay, everyone's PP'd up. So currently I understand one of the practices I work in, if you're not vaccinated, you won't be able to sit. You get streamed and you go because you're like a risk. So you go in with the infected people, right? Because you go into those, and we try and clean between each patient. So really, if you can get into your GP, you got concerns, talk to them, right? Because they're going to be the ones there managing you, whether you get sick from this or sick from anything else. And it doesn't kind of make sense to me. If you trust them with everything else in your life, why wouldn't you trust them on this, right? And so often I've heard, and I've been into Kawerau, I've been to Tokoroa, I've done face-to-face work, talking to people that are vaccine hesitant or anti-vax, and they trust doctors for everything else, but they won't trust them on this, and they think it's a political. They don't trust the government is a common thing I hear. But we're not doing this because the government are telling us to. We're doing this because we don't want you to get sick, and we don't want to have to look after you. We'd much rather do things with non-preventable illnesses rather than things that are preventable. So please don't get your advice from an expert who has done research on social media. They aren't going to be there to cover your ass or to look after you when you do get sick with whatever it is. And they're on the other side of the world. And, there's plenty of cases popping up in social media now from people that were either vaccine hesitant or anti-vax, and, and saying that they wish they got vaccinated. And, I've seen, someone I know climb Mount Everest, and they've just died. And a musician just died recently. And, that's the scary thing. Young people die, like 15-year-olds, fit, healthy, no comorbidities, can die of COVID. Another fact, and you probably know this already, it's going to become increasingly difficult to travel, work, and stay healthy and socialise if you are not vaccinated. And I know a number of cases, and I've talked to people, and they're anti, although I'm not going to do it. And as soon as they need to travel, when you can't travel without it, they go, all right, I'll go and get vaccinated. Or so many people were sitting on the fence and let's wait and let's see. Well, the time for waiting has stopped. It was in the water in Stratford. And it'll be everywhere else. And I know certainly cases I've heard from, people, my friends working in certain hospitals, that used to be like, why would you go to hospital and get a test? Because then you get put away on MIQ. So there's certainly a lot of people out there with COVID that haven't gone to get tested or haven't gone to get medical care because they were worried about going to MIQ. They'd much rather try and beat it at home. Some of you will beat it at home, some of you won't. So once again, it all comes down to protecting yourself. So look, summing up, get vaccinated to protect yourself, protect your mates, protect your family is big, because currently under 12s can't get vaccinated. So let's say someone who's non-vaccinated who carries it, either they're sick or they're not too sick, and they give it to you, and you might just get a little dose, or you might not have symptoms. You go home and you give it to your kids under the age of 12. And I believe there's a young child who's in North Shore Hospital who's a baby who's sick with COVID at the moment, and sadly it does affect kids. Definitely be more worried about the virus than the vaccine. I am. That's why I've been double jabbed, and I'll get triple jabbed, and I'd have a jab as often it would take to stop myself getting sick. And that's 32 years experience and being jabbed for everything else. Please get vaccinated. Look after yourself, look after everybody else. So any really vaccinations, questions or concerns, really recommend this covid.immune.org. Frequently ask questions, or go to just immune.org.nz. That's the Immunization Advisory Committee. And I was actually supposed to be presenting next week in New Plymouth as a dinner speaker, but unfortunately, it's been cancelled due to COVID, ironically. So they're doing it all online. So it would have been another good reason to come home and maybe get some waves as well. So look, once again, I just want to sum up with the fact that COVID-19, it's a health and safety issue. You've just, be safe, Taranaki. And the best way you can be safe in this current environment is to get vaccinated, get some PPE. It's not a political or freedom or any other issue, and people try and make it this, but it's not. It's just pure health and safety, and you wouldn't go to work without your high vis, without your hard hat, without your steel caps. So why would you go to work without internal PPE? Look, I hope I've alleviated some fears, and look, if you are vaccine hesitant, maybe you go and get vaccinated now. If you were anti-vax, maybe you're on the fence now and you've just shifted a little position. But I'm just trying to share my experience, and I'd like to think that I'm trusted in Taranaki, and I've worked hard there my whole clinical career. Really is trying to keep you out of hospital. Yeah, I really appreciate the opportunity, Be Safe Taranaki, to talk to you tonight. That's me there, and once the ambulance gets out of lockdown, it's lockdown in Auckland, we'll be going on a One for the Road tour around the country, and certainly want to spend a lot more time at home. And you can email me there, info@drtomonamission.com, and maybe we can do some workplace testing and come and see you when we can. So hopefully I'll stop sharing. I'm just thinking I had a little bit of anxiety. I was thinking, hope I recorded this thing, because otherwise I have to do the whole thing again. But anyway, crisis equals opportunity. It says pause, stop recording, so that's good. So hopefully it's backed up. It's always a bit of a shock when you see yourself on Zoom. I actually did a talk in Taranaki on Saturday night. It was nice to be in front of a live audience and see people's reactions. So hopefully your reactions have been okay. Once again, thank you to the team, Be Safe at Taranaki, and Graham for giving me the opportunity to speak to you, and look forward to seeing you out and about on the walkway, up the mountain, in the surf, or in a cafe, and certainly not in hospital. So take care and live long and prosper. Cheers.